Asthma is the leading chronic disease affecting children in the United States. African American children and children living in poverty have the highest rates of asthma.
My son was, he was quiet, but when he had to say something, he wouldn't even think twice about it. And he was very caring. So one day in April, I remember him telling me he had difficulty breathing. It didn't get better. I just took him to the doctor. So they gave me an inhaler for him, and that was it. And he never experienced that again until like about a month later. In May, the same thing happened. So now in June, where it happened again a month after that, his pediatrician told me that he was asthmatic.
You are your child's best advocate. It is important to recognize common asthma symptoms such as a persistent dry cough that lasts more than 10 days, difficulty breathing, shortness of breath, tightening of the chest, chest pain, wheezing, fatigue, and trouble sleeping. Asthma is a serious and potentially life-threatening condition. If you suspect your child has asthma, make an appointment with your doctor immediately.
I never had to take him to the emergency room until it got really bad. Maybe 3 days before, there was a fire, and the air quality was really bad. And so he complained that day. I gave him some cough medicine just because I thought maybe it would help him with his breathing. And I said, "So are you feeling good?" And he said, "Yes, Mom, I feel good." So I left, and he was left here with his uncle.
If your child is diagnosed with asthma, work with your doctor to develop an asthma action plan, a simple tool to help you manage your child's asthma. The asthma action plan is divided into 3 zones: green, yellow, and red, representing different stages of asthma symptoms. It lists important medical information like phone numbers, names of medications, and what steps to take in an asthma emergency.
His uncle called me, telling me he was having a hard time breathing. I dropped everything and I came as fast as I could. When I came, he was already on the floor, and his uncle was performing CPR. He told me the ambulance was on their way. The doctor told us one of his lungs had collapsed. My husband and I were just looking at each other, and we just didn't want our son to suffer anymore. I would like, parents to just really get all the information they can.
There is no cure for asthma, but symptoms can be reduced when your asthma is managed and controlled properly. It is crucial adults play an active role in their child's asthma management plan. Supervise a child under the age of 18 when they are administering their asthma medication. Share your child's asthma action plan with caregivers, including family members, schools, or daycare centers. Speak with your doctor or other health professional about how the indoor or outdoor environment may affect asthma. Remember, be your child's best advocate. With asthma knowledge and a self-management plan, you and your family can learn to better control and prevent asthma symptoms and episodes.